Dear students, in this video today I will discuss about mania, okay, or manic disorder. So it is the disorder about mood, okay. So if someone is getting too much excitement and getting full energy to do something, okay, for certain period of time, okay, not constantly, means if constant energy is there, that is not called as mania. So if someone is getting overexcited or elevated mood, and after that followed by depression, so it will called as mania, okay. So to handle or to control the mania, the drugs are called as antimanic drugs, okay, or mood stabilizer, okay. So these are the drugs which can control the mood swings, or mania is called as mood stabilizing drugs or antimanic drugs, okay. So in manic disorder, what will happen? Extreme excitable mood or elevation of mood, usually associated with bipolar disorder. So what does it mean? Means it will cause elevated mood or excitable mood with bipolar disorder. So bipolar disorder is nothing but sudden changes in mood, means more excitement, along with that after some time depression will occur. So bipolar means two phases of the mood, okay. You can in common or general you can understand that the mood is going to swing either very low or very high, okay. That is called with associated with bipolar disorder, okay. So this may happen because of habit changes, okay. So whatever the natural habit is there, if someone is going to change their habit or his or her habit, then it may cause, and most probably because of drug abuse or substance abuse, okay. So excessive use of psychoactive drugs, so drugs which are used for psychiatric disorder or any CNS related disorders. So if those drugs are prolonged using someone, so it may cause mania, okay. So psychoactive drugs, excessive use, or alcohol, as alcohol also, okay, and painkillers and illegal drugs. So these are certain substances or drug abuse which may cause mania, okay. So changes can be seen in an individual. So if someone is getting mania, so what will happen? His physical changes will occur, or behavioral changes will occur, or social or emotional harm will happen, okay. So it will cause many changes, okay, physically, mentally, behaviorally, as well as social harm, means he will be dissociated with social activity, means he will be far away from the social activity, okay. So what is the mechanism of action, why this is happening? Because in mania, level of dopamine may increased more, or noradrenaline or norepinephrine will increased more. So it will make hyperactivation of the nerves or neurotransmitter, which will cause high alertness or excitable mood or elevated mood, okay. So let us see mechanism through simple diagram. So if G protein coupled receptor, and this G protein coupled receptor is having the GQ subunit. Already you know that G protein coupled receptors is having three subunits: GS, GI, and GQ subunit. Okay, so GQ subunit is responsible to binding with phospholipase C. This is the enzyme which is present in the membrane, which is binding with this GQ. Phospholipase C, if binding with GQ, it is responsible to activate PIP2, means phosphatidylinositol bisphosphate. Okay, if this enzyme, this is the membranous enzyme, if this is activated by PLC, which is binded with GQ, then it will cause PIP2, okay, to activate and release IP3 inositol triphosphate and DAG in the membrane, means diacylglycerol. So which will cause DAG will cause PKC phosphokinase C activation, which will stimulate the cell response, and IP3 will cause release of more calcium ions extracellularly, and it will metabolization will occur, okay, and it will cause response towards CNS, so towards the cell, okay, cell responses will occur. So this is the function of PKC and IP3, means through DIG PKC is activated and responses are occurring, means cell response means signal transduction will occur, okay. So if this IP3 is going further but by recycling, so it is converted to inositol monophosphate, okay, or on phosphate. So this monophosphate, inositol monophosphate, will again induce this PIP2 through PIP, means inositol on phosphate, okay. So this is converting to PIP2 again, means in boosting this one to again regain the cycle to produce this one and to produce more responses to activate the DA, means dopamine or noradrenaline like neurotransmitters, okay. So if the drug particularly for mania management, we are most probable use or most frequently used is the lithium, okay. So if lithium is applied, then it will binding with this one here in IP. So IP means inositol phosphate is converted by free inositol by inositol monophosphatase enzyme, okay. So if here it is binding with this monophosphatase enzyme, inositol monophosphatase enzyme, then it cannot give free inositol to bind again with the PIP2, so to produce again DAG and IP3 to hyperactive the response. So if it is stopping here, so there is no precursor of reactivation of the PIP2, okay. So by that way there is cessation of the stimulation or responses. So lithium inhibit inositol on phosphate, okay, inositol on phosphate hydrolysis by inositol monophosphatase. So by that way reduction of responses is done, okay. So this is the mechanism how lithium is working. So lithium is the prominent drug used for controlling of mania, okay. So this is the mostly used drug for mania disorder, okay, manic disorder. So again another mechanism is that how it is happening, because free, already I told you there only, so again I have written here, free inositol for regeneration of membrane phosphatidyl inositides, means if this free inositol is going to bind with the phosphatidyl inositol which is present in the membrane, okay, cell membrane, okay, of that neurotransmitter or that neuronal membrane, so it is stopping, okay, supply of free inositol for regeneration of membrane phosphatidyl inositides are reduced, okay, because here it is inhibited, okay. Then which is a precursor to produce IP3 and DAG. So already I told you there. Thus response is controlled. So that response can be controlled, means overexcitation will be controlled, of elevation of mood will be controlled. So which is associated with bipolar disorder. So bipolar disorder is nothing but mood swings from high to low, means depressive or excessiveness of excitement, okay. So next we will see on CNS, lithium has no effects in normal. Lithium will not affect on CNS, but you know that just now you have knew that this is CNS disorder. So if lithium is not inducing CNS effect, then what will happen? So it why here telling no effects in normal individual? It is not affecting in normal individual particularly. Okay, but if long term use, it will affect lithium. If long term application is there, then it will affect. So in MDI, okay, in normal individual, or MDI means bipolar manic depressive illness, it is not affecting. But how it is affecting then? So after long time, means it will take at least 4 to 5 days minimum. It will take to effect on the manic disorder. Okay. So that is the thing here I am telling. But it established as standard anti-manic and mood stabilizing drug. But it is the established one and standard drug for mood stabilizing or manic disorder. Okay. So what will happen after prolonged administration? After prolonged administration, it acts as mood stabilizer in bipolar disorder. So after prolonged means in the sense at least 1 week. At least 1 week it will take time to control the disorder. Okay, means its mechanism of action, it will take at least 1 week to control. Okay, to show the effect of lithium. So other effects, or what are the other effects of lithium on the other body parts? So lithium inhibits the action of ADH, antidiuretic hormone, okay, on distal tubule. So what is this is responsible for controlling the water balance, okay, in our body. So if this is inhibited by lithium, then what will happen? It will cause more micturition, means more urination will cause. Okay, causes diabetes insipidus like status. It's not permanently, for certain period of time, means 10 to 15 hours like that. Okay, so its highest body distribution and its T half is at up to 30 hours. So initially 10 to 12 hours, and after second phase it will take 15 to 30 hours. It will cause that effect. Okay. Then other effect, insulin like action. So what is the function of insulin? Insulin is breaking down the glucose to utilize in the blood and as well as in other body parts, particularly brain. Okay, so breaking down of glucose in the body is by the help of insulin. Okay, so this lithium also act like insulin, which can cause glucose metabolism. Okay, then leukocyte count means white blood cells count will increase with lithium therapy. So whoever getting lithium therapy, their leukocyte count will be increased. Okay, then lithium decrease thyroxine synthesis. So thyroxine present in thyroid gland, which is responsible for growth factors and heart rate, okay, controlling diabetes, and pituitary gland and all other major functions it is controlling by thyroxine. Okay, so if lithium reduced thyroxine synthesis by interfering with iodination of tyrosine, so tyrosine is the precursor of thyroxine, so it is interfering with iodination of tyrosine to reduce the thyroxine synthesis. So whatever the related function of thyroxine, it could be stopped or reduced by lithium therapy. So these are the other effects. So pharmacokinetics, how it is working. Okay, so lithium and control therapy means how could we control the therapy, because overdose can cause toxicity in the CNS. So lithium slowly but well absorbed orally. So it can be well absorbed orally, but it will take slow absorption. Already I told you, and effect also very slow. Means it will take at least 4 to 5 days or up to 1 week to produce the effect. Okay, so then this is neither a protein bound drug nor metabolized or metabolized. Means it cannot be metabolized by any organ like liver or kidney, nor it is protein binded. So what will happen? It will directly going to distribute on the body fluids, means water. Okay, into the water of the body. Okay, and whole over the body. First distributed in extracellular water. Okay, whatever the presence of water in extracellularly, there it will be going to distribute and penetrating to cells, then going inside the cell, and then finally penetrates into the CNS. So this will happen. Then apparent distribution means in normal on total body fluids. It is apparent distribution in body fluid is 0.8 liter per kg. This is very important to control the therapy. So this is the range through which it is distributing the lithium in the body fluid. Okay, 0.8 liter per kg. Then monitoring of serum lithium level. So in serum lithium level we should monitor. So it is very important. And after taking last dose of the lithium, so after 12 hours of last dose, okay, means after 12 hours of last dose, okay, its optimum range should be between this one. What is that? 0.5 to 0.8 milli equivalent per liter. So meaning in 1000 on milli, okay, 0.8 milli in 1000, okay, in 1000 milliliter, okay, it is 0.8 milli equivalent per liter, the distribution rate, okay, optimum range. So it is secure. In which disorder? Bipolar disorder. So don't be confused bipolar and manic. Little bit here difference is that bipolar means with two disorder at a time, means with acute or chronic excitement, elevated mood along with depression, that is called bipolar disorder, okay, that is called MDI. But manic is nothing but single phase of mood, very high elevated mood, excitable mood, okay. So his feeling may happen that I can do anything, okay, at any time, like that. So no one is there who can challenge like that I could do anything at any time. So if someone is challenging for a certain period of time, so he may have that disorder, manic disorder, okay. So high thought, high excitable, high mood elevation, okay. So this is the thing. So for bipolar disorder means manic high and manic low, 0.5 to 0.8 milli equivalent per liter is needed, the optimum range of the dose, okay, or distribution range. This one distribution range of the body fluid of lithium. And for optimum range in case of episodes of mania, it is 0.8 to 1.1 milli equivalent per liter. So these two ranges you should remember. This is very important. Then over 1.5 milli equivalent per liter will produce toxicity, okay, in other organs, and in CNS it will over 2 milli equivalent per liter, okay, for CNS. So this is all about lithium. So some persons who is getting lithium treatment, they may have other side effects. So that's why it should be divided into 2 or 3 or 4 doses, 2 to 4 doses. Then it should be given, because after immediate getting lithium, it will produce diarrhea or vomiting or nausea, like this means side effects, okay. And even in coordination in CNS, if over 2 milli equivalent per liter is distribution rate is there, so it will cause toxicity in the brain, okay. Ataxia will occur in coordination of the movement or any other functions. So some patients still may not tolerate it towards the lithium. Then for those patients, other drugs may use as carbamazepine and sodium valproate and olanzapine, etc. Other drugs also there, okay. But this lithium is good and standard drug if it is properly managed, okay. But it may contraindicate with other drugs like tetracyclines, okay, and tetracyclines and diuretics like thiazide, furosemide, by causing sodium loss, promote proximal tubule reabsorption, means it is losing the sodium reabsorption from proximal tubule, okay. Then plasma levels of lithium will rise. If reabsorption of sodium is lost, then reabsorption of lithium will occur, because this is also cation. So this sodium ion reabsorption and lithium ion reabsorption is more or less same. So if sodium ion is reabsorption is disturbed, then lithium absorption will be retained, means reabsorbed more, and plasma level of lithium will rise. So by that way, diuretics like thiazide, furosemide may cause sodium loss, promote proximal tubular reabsorption. Okay. Then tetracyclines, NSAIDs, and AC inhibitors can also cause lithium retention. So this, and lithium reduces pressure response to noradrenaline. So noradrenaline response also can reduced by lithium. So lithium tends to enhance insulin or sulfonylurea induced hypoglycemia, means who are under the treatment in diabetes by sulfonylurea, so they may also cause enhancement in insulin production. Okay, then these are the all about interactions. Okay, so lithium is used as its carbonate salt because this is less hygroscopic. Okay, with carbonate salt it is used. Okay, not directly as lithium. So lecab is the medicine which can be used. Okay, or lithosan 300 mg tablet, 400 mg sustained release tablet. So this is about lithium and other drugs in management of mania, okay, or manic disorder, or mood stabilizers or mood stabilizing agents. Okay, thank you to watch this video. Subscribe, like and share.